Thanks so much, Rini, and it's over to you.
Thank you very much, Hugh. I really appreciate that. Good morning, everybody, and welcome to this first webinar on behalf of the South African AHP Waste Forum. I'm going to moderate this session. I will also present on behalf of Mark Kalina because unfortunately he couldn't make it. Then after that, I will introduce Mr. Mulalo Chikotsi from DFFE, and then Nikki van Hul, who will do the last part of the presentation this morning. Oh, sorry, my presentation now disappeared. I don't know why that happened. Okay, so let me just do the introduction. So the AHP Waste Forum is just a quick brief for those maybe who don't know about it and what we are there for. It's a members-based non-profit company that was currently established. It's dedicated to advancing equitable, sustainable and inclusive management of AHP waste across South Africa. And the forum aims to bring together government, industry, researchers, municipalities and civil society partners committed to tackling the growing challenges posed by nappies, sanitary pads and incontinence products. And I think we don't have to explain why this is a massive problem. We just wanted to give you a little bit of an overview of the dates and the milestones that we have achieved. This process actually started before November 2023, when a group of concerned people started to network and talk and have webinars and groups. But it came together in November 2023 when we established the One Health AHP workshop. And then from there on, Kimberly Clark, as you were saying, became involved, and they supported some research projects in South Africa. We created the Interim Forum Committee in April 2025. And then we started with the whole process of creating a formal NPC, which is nearly completed. And thanks to you, Tyrrell, who was actually the driving force behind that and get all the paperwork done for the NPC to be established. So we had our inaugural directors meeting at the beginning of the year. We commented on the draft strategy that is in process. And so we are up and running. So for quite some time we were quiet and we felt bad about it, but then we thought now we can start moving because all the paperwork is done and all the formalities is behind us. So our vision statement, just a repetition, yes?
Sorry, I just want to let you know your screen is no longer sharing, so I'll share from my side.
Okay, I don't know why it disappeared. So can you go to the vision statement? Thank you. So our vision statement is a South Africa where all communities, regardless of income or location, have access to safe, dignified and sustainable solutions for AHP waste, reducing environmental harm and promoting health and social equity. Thank you. And the mission relates to that. You can go on to the next one. So what do we do? So up to now, I think our activities are major in terms of convening, coordination and networking. We support collection and service provision and where we can guide as well. And then we do policy engagement and applied research. And I think today's presentation by Nikki van Hul will be an example. Next one. So we really are glad that everybody's attending, and we invite you to please visit our website, and you will post the link to the website on the chat. You're welcome to register as a member, and we will also share the link for the registration. And keep us posted on activities, projects, ideas, concerns. There will be a newsletter that will go out soon. And I think the major thing is to engage with us. So thank you very much. And I hope you will enjoy the rest of today's webinar. I'm now going to introduce Mr. Mulalo Tikoti from the Department of DFFE. He is the Deputy Director for General Waste. So Mulalo struggled to be heard. So Mulalo, can you hear us? And can we hear you?
Good morning. Yes, I can hear you. I'm using the phone now.
Okay, thank you very much. And Olivia will share the PowerPoint. And thank you very much for being here, because we are really keen to hear about what the update is regarding the strategy.
Good morning, colleagues. Again, it's Mulalo from the Department of Forestry, Fisheries and Environment. I want to thanks for the opportunity to present what's happening in terms of this AHP strategy. I think I will just not read line by line, because the issues are very well known. The AHP is being a problem, is being problematic waste all over the country, whether it's rural, it's urban. We are really facing this increasing problem. So we know the quantity of this AHP is growing, and we find it everywhere. It's unfortunate that if it's not a landfill, it goes to our environment. So those are the issues that I will really, I'm sure that we all know. Next slide, please. I will just be giving a very high level highlights in terms of what has been happening and what we think should be the way forward in the strategy. The strategy is really looking at bringing everyone on board. Thanks for the forum. It really has got the same vision, the same principles. I think the country want to achieve the same goal, which is ultimately to address the AHP waste in the country. But that doesn't come by a single person. It will need all key role players on board, whether it's private, municipalities, and specifically the producers. So these products are predominantly disposed of in our landfill, and that we know. There is limited collection currently. There is limited treatment. There is no recovery or very little recycling system, or it's not there at the moment. So we're hoping that that could be something that could be achieved through the implementation of the strategy. So the increasing of this material, it's mainly due to the fact that we don't have all this system in place. So it will end up constraining our landfill and of course our environment. So that's therefore necessitate the development of this strategy as a government, which will for sure bring together everyone. So it has been developed, and I think Prof has mentioned that the input were received, and that is very much appreciated. We received 14 inputs, written inputs, during the public participation process in April last year, and we thought that was not enough. Let's continue the whole year of last year, trying to get reach all the other people that we thought we might have omitted them in the system. Because we know, especially municipalities did not provide input. So we said, through their waste forums, let's engage them in their waste forums, provincial forums where they are. Let's hear what they say, because we believe their landfill that they own is really affected by this. Next slide. So that development was done through the service provider, but they have completed their work. We are currently engaging with the presidency. Colleagues will know there is a so-called socio-economic impact assessment that any policies that are being done in the country must go through that to check if everyone has been consulted and to check if it is balanced, it's going to serve the country, it's going to protect the environment while saving the country. There's a whole lot of socio-economic issue that needs to be considered. So that has been done. Currently, we are engaging with the press office of the president for that, with all your comments that you have provided as private sectors and as a public and producers as well. So we like I said, we required full cooperation from all parties. Could be the department, the human settlement, your private sectors, institution, academic institution, consumers, and others. We require full cooperation in order to have this strategy go forward. Next slide. That beside the public participation process, which include the government gazette, there's been before, during the development, there's been this consultation with stakeholders in Western Cape, KwaZulu-Natal, online platform, so that we can make sure that everyone is given an opportunity. Workshops as well, where we include the departments, various departments, your water affairs, you know how much they are affected when, in terms of water qualities, in the rural areas, these are being disposed in open land that goes through their waste streams that they manage. So it's really affecting them, municipalities, the blockages, and some of the communities do not prefer to collect these types of waste because they feel it must not go anywhere. They must just hide it or dump it somewhere where it's not seen. So it has to do with the belief of people as well. Then we got all these comments. Fortunately, most of the comments are very positive. We didn't really get any negative comments, but the good thing is that we were advised to really improve that strategy, especially in terms of how it will be implemented, because we feel that the people who will be implementing the strategy are not necessarily the department, but it's a whole lot of other people, including your consumers and producers. So it was then presented internally to our working groups and ministers, and that process has been finalized. We will be submitting it to the minister for implementation. What does that mean? It means once it's out for implementation, whoever has got role there will have to start implementing in terms of his or her role in the strategy. The roles are clear. If it's a government department, it's clear what they should do. If it's producers, must be clear. Next slide. There have been other initiatives that we appreciate, and that has really helped to conceptualize properly this strategy. Collaboration with researchers and academic institutions, that has really assisted, and it's still going to assist, because we will really love to have this kind of engagement going forward. This is a continuous intervention that we will need to collaborate with all people who are assisting on board. Kurugatu Canyon project is just one of the examples. There are many. Smart Navy project in the Eastern Cape. This forum that we are presenting today is very crucial, and we find it very helpful, and we are sure that we will continue working together with this forum. It's going to be an ongoing, and it will be continuous collaboration. Next slide. There are some few things there in the strategy that, in terms of implementation proposals, we know that the current legislative framework, it requires a policy instrument that will enable effective implementation of waste management. So that is lacking. So as a government, we believe that if we can have a policy instrument that will be able to enforce the roles and responsibilities of key role players, then we will be able to address these issues, because the roles must be clearly defined, and therefore it must be practical. And if we say producer must assist or support municipalities, then that is a very simple, straightforward role for the producers to do in order to address this waste. The extended producer responsibility, when we say it may be considered, but this has come very strong. This is a policy where we allow producers themselves to take the responsibility, more responsibility of post-consumer. When we engage with producers of other products, this policy is already there for paper and packaging and electronic waste. It is working quite well. We've got 4 years. It's 4 years old in terms of implementation. We have seen a lot of intervention by producers of their materials. They collaborate with municipalities. They assist with waste awareness campaigns. They are supporting SMME who are collecting. They are creating enabling environment to collect the type of waste they produce. That means somehow the type of waste they produce is being improved. For example, it will be recyclable. Some of them are making 100% recyclable, because this EPR comes with targets in terms of how do we want the material in the next 5 years to be improved, so that it can be collected easily with value for money. They are integrating the collectors, the waste pickers. They are working very well in terms of providing infrastructure. We know this waste stream lacks infrastructure. There is no technology for treatment. There is no technology for recycling. That is still something that we hope in the near future it can be done with the collaboration of government and the producers. That is how the EPR can improve this collection. One day we will see this waste stream being treated, because even if we work hard in collection, we still need to be able to assure, to say this is what we are doing after collection. That's the biggest issue we have, and other things like recovery. So yes, we're hoping that could be something, but it's strongly being recommended. We hoping to establish a more working group with government departments. We're hoping to work with producers to create incentives program to assist all the interested and affected parties, and also increasing personnel within the departments. It's not only the environment departments, but it's other departments that need to play a role in that. And then, of course, when we do have authority to monitor all this regulatory instrument in terms of implementation. Next slide. That was my last slide, colleagues. Thank you. Thank you.
Thank you very much, Mulalo, for that, for being so informative. I'm going to, I hope everybody is sort of writing down their questions, or you can post it also in the chat. We're going to continue to Nikki van Hill. She's the director from the Moss Group, and she's a senior strategist, and she's busy with the project, the research project on the true cost, or the update on the project of uncovering the true cost of mismanagement of AHP waste. So this project is funded by Kimberly Clark. So Nikki, I'm going to hand over to you, and then we will have a question and answer after that.
Great. Thank you so much, Rini. Really appreciate it. And good morning, everybody. Thank you so much for making the time. Yeah, I think this particular project, I'm just going to share my screen here. This particular project is very, very interesting. We are doing it in collaboration with Green Edge. So Hugh, sorry, I'm just checking here. Sorry, with Hugh, also with Rini and Mark at UWC, and then the Greenhouse, which is a consultancy that looks very much at sort of large-scale environmental impact assessments. They do a lot of life cycle impact assessment work. Unfortunately, Pippa couldn't make it today. But yeah, this really just wanted to give you an update. Some of you may have seen some version of this presentation, but I think hopefully it puts on the table a little bit more around the practicalities of why we really need to be addressing AHP waste on scale. So what I think everybody's aware of this is that AHP waste, wherever you are, we're not just in South Africa, but across the global south, it is broadly mismanaged and typically results in very, very many costs. Some very obvious costs. You think about illegal dumping, people having to clean that up, that's an immediate direct cost. But there are lots of hidden costs as well that we often don't think about when we think about AHP waste. So what we're trying to do with this project is say, let's look at everything out there and say, what types of costs are we incurring as a society, as governments, as business, as NGOs? Where are those costs actually occurring? Who is accountable for those costs? And ultimately, really importantly, how much are those costs actually costing? The reason why we do this, if you think about it, we all know there's lots of literature around issues relating to AHP waste, but nobody's ever put a rand or a dollar number to it, saying it costs South Africa, and I'm making up a number here, R1 billion every year due to mismanaged waste. If we could put that number to this waste, I think we get a lot more traction in terms of actually looking at putting together a business case for investing in the infrastructure and solutions to address it. So it really is about, once you shine the light on cost, everybody tends to sit up. It's a very sad fact, but we live in a society where money makes the world go around, unfortunately. So how we went about this project, we went through it in several steps and several phases. The first one was really a very comprehensive literature review, looking at all the literature around the world in terms of what happens to AHP waste, particularly in the global south, and has anybody attempted to quantify what the impacts of these things are? In a nutshell, what came out of that literature review is that the impacts are very broad. We've got a good idea at a high level of what these impacts are, but they're very poorly understood. Also, what typically happens is that AHP waste, when it comes to discussions around it, very often gets lumped in with your general household waste. It's not separated out and dealt with as a topic on its own, even though it is actually a very specific topic. In terms of what we could see from the literature, you could see where we could identify where mismanagement is typically happening, but nobody's tried to put any numbers to it in terms of cost. And then very interesting, I mentioned the Greenhouse who do life cycle impact assessments. They also came across this issue, is that very often when LCAs are done on AHP, they very often forget the disposal aspect of it. They look at what the LCAs relate to in terms of materials going into the product. So, for example, the polypropylene outer, the SAPs, etc. But they're not necessarily looking at what happens once these things get disposed of and what are the long-term environmental and social and economic impacts. So, long story short, there's not much in the literature. We could use it as a base off which to work, but there are no answers, unfortunately, in the literature. Oh, by the way, in terms of, you'll see this is if you're looking for the summary of the literature review that we did, Mark and Rini put a paper together that you can find there. It's in the Waste Management and Research Journal. So if you want to have a look at what's out there in terms of a sort of summary of what we found, it's there. And I think just kudos to Rini and her research group, because of all the countries in the world in terms of research, South Africa is actually the most well-researched from an AHP waste perspective. So, and I think a lot of it is driven out of Rini's area and from the chair. So once we had this literature review, we then went on to say, okay, well, let's figure out what all the different impacts could be of mismanaged AHP waste. So we took the literature review, then we had a very comprehensive stakeholder workshop. In fact, I see quite a few of the people on this call were in that stakeholder workshop, where we gathered local, provincial governments' inputs, industries' inputs, civil society, academia, NGOs, everybody's inputs into say, okay, where are these things going in terms of disposal routes, and what would the impacts be of these disposal routes? So you're talking about everything, you see my little icons there, everything from flushing, and we're talking predominantly there, it's sanitary waste, so sanitary pads, tampons, disposing down pit latrines, we see a lot of that in terms of nappies, going to landfill. Even though that is the best current solution right now for AHP waste, it's still not an ideal situation. It takes up quite a lot of landfill space. I think from the landfill characterizations in Cape Town, I think we're looking at about 7% of landfill, if I'm not mistaken, is actually attributable to AHP waste. So that's using a lot of airspace. We're also talking about illegal dumping. We often see it along riversides, out in the veldt, burying of it, and often it's shallow burying, and then burning, and sometimes shallow burying and then burning, and burning with accelerants. So you can imagine all of these things have quite severe impacts on air quality, on our water. So, whether it's leaching or whether it's getting stuck in, into our rivers, etc., into soils, into our infrastructure, getting, blocking drains, those kinds of things. And also on living organisms, whether you talk about animals eating nappy waste on illegal dumps, or human health, where it's children. We've all seen pictures of it, children playing on illegal dump sites. They are, if these nappies and sanitary products are there, they actually are interacting with human waste. We know what that can do from a human health perspective. So it's mapping out all of this. I one of my slides, I think I once showed a picture of the spaghetti diagram, as I call it, in terms of where all of this stuff goes. And it really is a spaghetti diagram, because it can land up, for example, getting getting dumped, and then it lands up getting washed down the river, lands up in the ocean, getting eaten by ocean organisms. So it can have lots of knock-on impacts. All of those impacts have some sort of cost to society, and that's really what we're trying to quantify. So, of course, with all of these different things out there, we needed to really prioritize where we were going to focus. I don't expect you to be able to read this grid, but really what we said was we'd focus on those that have probably the highest impact and also are the most likely to happen. And really these things we broke down into environmental pollution or big picture impacts. So the things that, if you think about it, we're all impacted by it. So for example, climate change, everybody's impacted by climate change. Burning of something and releasing gases that are greenhouse gases, those things can have quite significant impact, but it's not just on the local community, it's everybody. Have impacts, carcinogens, toxicity, particulates on humans, land. So that's talking about acidification of soils and ecotoxicity, water, we talk about eutrophication. So that's when there's, particularly because we're talking about human waste, that provides a really nice breeding ground for, algae and other things and plants using the nitrogen. They grow to aggressively essentially suffocate the fish life and the insects within a water body. So those are all big picture. Then we go down to more location specific. So where these things are actually dumped. If it gets flushed down a toilet and it blocks a sewer, it goes into that infrastructure, and it can have quite a catastrophic impact. It can, we're talking about actual direct landfills. We're talking about the local ecosystem that communities rely on, and natural capital degradation. I mentioned the issue of human health, so children playing on these illegal dumps. I talked about animals eating these products. What we have heard is, when this happens and it's livestock, the livestock can get sick, it can become emaciated, and people stop wanting to buy the animals that these communities are raising for their own economic well-being. So or they're not willing to pay as much for those animals. So the people who are raising these animals are now at a disadvantage because essentially their economic livelihood is at risk. So those are very specific to an area where nappies and sanitary waste might be being mismanaged. And then lastly, there are things you can't necessarily put a rand value to specifically, but that really have an impact on a community's well-being. So if you think about it, if you're living in a community where these things are illegally dumped, where they're burnt, where it's not only the health issues, it's just they're unsightly, they can reduce the value of your property. Living in an environment like that is not a great space. So just trying to quantify on a scale, we're not trying to do it in rand value, but trying to determine the impact on well-being of a community as a result of these things. So that sort of, just to zoom out again, looking at very big picture impacts, looking at localized impacts, and then quantifying the costs of both of those, and then looking at the community in terms of its well-being. And each one of those impacts that we talked about, we are looking at actually quantifying. So last year, we finished it in February this year. We finalized the framework in terms of what are we going to quantify and how are we going to quantify it and where we're going to get the data. And then we developed what we call a computational model where we can actually work out what these things impacts are in terms of rand value. So that was really the theoretical context behind all of this, but that's all just theory until you actually test it out, which is where we are right now. We have launched a project in KZN. It's 2 informal settlements, largely informal settlements, called Johanna Road and Siotatuka. You can see the map over here. It's actually, these settlements border a tributary of the Umgeni River, which is one of the most polluted rivers in KZN. And what's nice about this area is the Johanna Road area, there is an existing nappy collection model in place that has been operating for about 2 years. Siotatuka doesn't currently have a nappy collection project, but there is a program planned for later this year. And it's also a mix of formal and informal housing. So it's going to give us some very interesting insights into how these nappies affect both informal people living in informal housing and informal housing. And will also hopefully indicate the difference when you have a nappy collection program in place versus where you don't. So we're literally in the process now. We are engaging with the eThekwini government to get data. Not an easy process. Belinda will know we tried to do it in Cape Town as well. Accessing data across directorates within in a city is not an easy escapade, trying to just get them to release the data, but also what we're finding is they very often don't have data. So hopefully this project will help us shine a light on what data they need, but then we'll also give them a big picture view of what is actually happening across the board, everything from blocked sewers to informal dumps needing cleaning and the cost of that, to what the cost of dumping and burning might have on, for example, the health of those communities. So it is a test case. What we are also finding, just by way of sort of an update, is it is quite difficult to do it on such a narrow geographical area, because as you can imagine, cities don't always capture data at that level. But what is nice is that we can get community engagement data. So we are literally launching, in fact, this week we launched the household survey, where we're going to interview about 300 households in those areas to understand what their experience is in terms of AHP waste management and AHP waste disposal. We have also completed a nappy dump assessment. Well, sorry, not a nappy dump, a dump site mapping exercise, so nappies and other things in that area specifically. So there's certain things you can do on a very small geographic area. Other things we're going to have to make inferences from a broader data set, for example, for Durban as a whole or a particular ward. But I think what it's going to do is be able to give a very, very clear perspective to all the stakeholders in that area of the real cost of mismanaging AHP waste, and be able to then inform what their specific way forward is in terms of managing the waste. So it's an ongoing project. We are hoping to complete the case study by November this year, in which case we will hopefully be able to present the results. So I think that's me. Thank you very much. I hope that made sense.
Thank you very much, Nikki, for the presentation. And now it's open for question and answer, some question time. And if there are any suggestions, this is an ongoing project. If there are questions around the project and what we're doing, it will also be accepted, and be grateful to hear about that. So maybe I can just go to the first question, and that is from you, Tyrrell, for Mulalu. What is the expected deadline for when the DFF AHP management strategy will be released for implementation? If you could give us an indication. Is there some form of indication around that?
Oh, thanks. We were hoping we were hoping that we would have done that end of June, but unfortunately we got some input from the presidency. I think it was 3 days back. So we just need to address those. There was some concern in the document itself that needs to be addressed before it goes out. But it's not something that will be very difficult. So maybe after that, then we'll send it back to the presidency. Once we get the approval from presidency, then we will get approval from our minister. So it's already submitted to the minister, but we're just waiting for that approval from the presidency. So I don't think it will be something that will take another 3 months. Thanks.
You're muted, Rini.
Any other questions or comments? Janus? Janus, you're muted. Olivia, Janus tries to come. I don't know if there's a problem with his.
Let's see, I'm trying to see on my end.
Unfortunately, we can't unmute speakers.
Um, okay. Janus, we can't hear you. Maybe if you can write your comment, your question in the comment box, please, if possible. Maybe try again. No. Okay, it might, maybe if you can write your question in the comment box, please, because we can't hear you. Yeah, now we can hear you.
Yes.
Yes.
Okay, I think it was the headset that was
Yes.
preventing from having a conversation with you guys. Big thanks for the presentation, everybody. I have a question to both, actually, to Nikki, but also to Mulalo. Maybe first a comment, Nikki. Well, thanks for the presentation. You mentioned that some of the LCAs kind of forget the waste disposal part. The LCAs that I'm aware of, in particular, done from by the UK government, but also in the US, those are actually including the waste treatment part. And we know that the end-of-life part of the LCA contributes between 5 and 15% to the total impact. The majority of the environmental impacts in an LCA actually come from the raw material production. So not the nappy production, but even the step before. So I don't know which LCAs you have in mind, but the ones that I'm aware of from the UK government, DEFRA, for example, from the US, from Germany, from France, all of them actually included the waste treatment parts. So I'm eager to understand which ones do not do that.
Thanks so much. I think in terms of, and I speak under correction because this is very much the greenhouse's space, not mine. I'm not passing the buck. I just don't want to speak about something I don't know a lot about. I'll follow up with them. But I think my understanding is that where they're looking at it in international papers is they're not necessarily looking at mismanaged AHP waste. So it might be, one or two end-of-life options, but not necessarily looking at the end of life where it is, necessarily goes to landfill or where it may land up in the environment. But I will check with Pippa and
okay, super, thank you. And then allow me a second one. Actually, I heard you mentioning that nappies make up to 7% at the landfill. I would really challenge that number because that is, looking at the amount of nappies that we're selling in South Africa. So if I take numbers from the US, for example, which I would consider a fully mature market where we have nearly 100% penetration of nappy use, not PNG, but also across the sector, then the amount of nappies in a landfill is 0.01%. So the 7% in South Africa, I found it hard to understand. So maybe it might be another fact to check because this is not matching the numbers that we have seen in the literature.
Again, I think it's not just nappies. So I think these are based on waste characterization studies, and it's 1 or 2 waste characterization studies. Part of our process is getting as much data as we can. But it was certainly, if I remember correctly, and hopefully Rini or Hugh, you can jump in here, but I think it was mentioned by the solid waste manager in Swellendam. And it's AHP waste in its totality. So that would include sanitary waste as well. So I'm assuming, that would cover that. But again, we are, those characterizations are there, and we will dig into those.
Okay, thank you.
Thank you, Janus. Can I come back to you? Can we just give somebody else a moment?
Sure.
To ask a question, and then we can give you another opportunity. Maybe you can just introduce him. Janus is also from Procter & Gamble, and we really appreciate it that the producers are attending this webinar. Sally Benson.
Good morning, everyone. Thanks. This is very interesting. I'm from an air quality view, and I've noticed in the air quality section we can regulate factories, industries, but it's very difficult to get the message of air pollution through to the person in the street. Currently, vehicle emissions is our biggest, or one of our biggest contributors to air pollution. So I was just thinking, if I bring this into the nappies, how are you getting your message through to the people, actually the culprits, that are disposing of the nappies out? Have you started with something like that? And I'd just like you to share it with me. Thanks.
Sally, I think there are different projects going on. I don't want to answer that. I think there are, maybe we can ask, if there's time, we can ask some people that are really, somebody like Amanda Clark, who is, I know is on the call, and how they work in the communities and dealing with that. Amanda, would you like to maybe respond to something like that, because you're on the community level in the rural areas?
Good morning, everyone. Can you hear me?
Yes, we can hear you.
Yes. By carrying out the information to the communities, so we mostly do the community awareness. But before doing the community awareness, we started doing the surveys where Prof. Rainey did assist us in terms of creating the questionnaires. The reason of why we did the survey is to understand the behavior, because we can't just go to the community and then we just tell them, hey, stop disposing the nappies all over the place. But we needed to understand why are they doing it and where are they disposing. As much we saw that it was mostly they were mostly disposed in the water sources, grazing areas, but we needed we needed to understand the behavior. So after conducting those surveys, and then we started by doing awarenesses through the clinics where we had to partner with Department of Health. We went to the community in Bezos because they're having like sort of a meeting with their traditional leaders. So we go there, we'll go to events like the municipal events. So that's where we carry out the awarenesses. It wasn't easy, but we had to continue to do the awarenesses until the behavior was shifted, and then we managed to get people shifting from the disposables to the smart nappies. So to measure that the impact, the awareness has worked, we have measured it by the number of users. Right now, we have more than 200 users starting from last year. So thank you.
Thank you very much, Amanda. Dimakatsu, your question?
Thank you and morning, everyone. So I'm from the healthcare sector. So I just wanted to understand what will be the expectation from healthcare facilities, considering that we have low risk and high risk areas. So with the nappies that are generated from those risk areas, we normally identify them as low risk, and we often view that it can potentially be disposed as general waste. So I wanted to check with the DFFE in terms of the legal requirements. Are we still expected to manage all the nappies that we generate across the healthcare facility as healthcare risk waste, or should we separate it from healthcare risk waste, contain it separate, and then make sure it still undergoes autoclaving, and then the residue can still go for landfilling? Or should we directly send the nappies that are generated from low risk areas directly to landfilling? I think we need guidance on that one because it's a bit confusing for the healthcare sector.
Mulalu, are you willing to answer this one?
Thanks, Chair. I think it's a bit tricky. We have waste that is contaminated, and then it's no longer a general waste; it becomes a health risk waste. So I think one of the recommendation is in the strategy is really to have the separation at source. Maybe when we do this awareness as part of implementation, then we will be able to engage the healthcare facilities to really separate that, because it might put us at risk to treat them same So I think it's something that needs to be explored and separated from the source. Thanks.
I know also that Belinda is on the call. Belinda, you had previously spoke about this. I don't know if you want to comment on this as well.
Yes, I do want to comment. The legislation currently says only the waste of isolated, the isolation waste in healthcare facilities are regarded as healthcare risk waste. So the legislation does not say that all waste generated at healthcare facilities is regarded as healthcare risk waste. So I think we need clarity around that, because the implications are quite huge. If one thinks of, for example, the frail care facilities, etc., where the only problem is incontinence, and by not having a very clear guideline on this, it actually has a huge cost implication for those types of facilities who really struggle. Because I mean, I think we're also ignoring we maybe underplaying the fact that there's a huge volume of nappies generated in the frail care centers, and the aged, and anybody in their later years. So there's quite a huge volume of nappies that are now being generated there. And I think we need to look at that very carefully, because the legislation, as far as my knowledge is, it says that only the waste of isolation wards is regarded as healthcare, and talking about sanitary waste as healthcare risk waste. That is the way I understand it. But I mean, I don't know if there's been any further developments on that. Thank you.
I see that Melvin was giving you a thumbs up, and I think he's one of the knowledgeable persons at the moment regarding that.
Yes, that's correct. What Belinda said, it is the exact same way. Certain parts of a facility could be a healthcare as waste facility where the infectious people are treated. On the other side will be the healthy persons who's just on incontinence waste. So that's the difference, and it does have a cost effect on either or the stream that you handle in that case.
Thank you. Are there any other questions? Then I go back to Janus. I don't see a hand up at the moment.
Can you hear me now?
Yes, yeah, we can hear you.
Excellent, good. Well, we'll crack the technology finally. I do have a comment or question to Mulalo, if I may. Just two things. One is on your presentations, you mentioned it takes up to 500 years for nappies to decompose in a landfill. I would like to ask to check for the evidence for this, because nappies exist only 30 years in the market, and there are no scientific studies that show what happens to nappies, in terms of biodegradation, because the conditions they differ so much. So in some countries you have a lot of humidity and low temperatures. In some other countries you have dry conditions, high temperatures. So actually nothing will happen in dry conditions and with high temperature. So the variation is very high. So I think I would like just to be cautious with spelling out numbers when there is limited scientific evidence for that. And then I have a second comment on the recycling of AHPs. I personally worked on the recycling of AHPs for 5 years with an Italian company, which today is called Euphoria. So they used to be called Fater Smart, and actually they call now themselves Euphoria. And I can reassure you, we did everything we could to establish this in a number of markets. We tried this in the UK, in the Netherlands, in Germany, in France, in Japan, in India, in the US, and even in South Africa. And we had conversations with the DFFE about 8 to 10 years ago. Long story short, the problem is that there is no business model that enables the collection and the recycling of AHP waste in a financially self-sustaining way. It just does not work. The best of our knowledge, I spent 5 years on this, it doesn't work. And why? Because the nappy, when disposed of, is not the nappy anymore. 70% is human waste. So what you're trying to do is you're trying to recycle human waste or trying to get rid of human waste and then recycling the remaining 30%. And that is killing every business model. I'm just leaving that as a comment here for you to consider. Happy to engage in a more detailed conversation. If you want offline, I can write a book about this actually.
Thank you very much. And I see Mario. Mario's hand was up. Please come in. Mario is from Kimberly-Clark, so we have him available as well. Mario? I don't see him anymore. His hand was up. Mario, are you still on?
Can you hear me now, Rini?
Yes, I can hear you. Thank you very much. I'm glad you're here.
No, I just wanted to pile on to what Jonas has said, and that's, we've asked our raw materials group about this common misconception. The timeline that they're attaching to diapers, degradation, I've heard 350 to 500 years as well, Jonas. This is just a misconception, honestly. It's a timeline that's attached to plastic, okay? Where this idea that diapers are, degrade the same way as conventional plastic. They may or may not, but also to add to what he said, I've also looked for some scientific proof of this. It does not exist. You can go ahead and use all your fancy AI tools and find this number somewhere. I can guarantee you will not find a number that's attached to this, not anything with any credibility at least. So they just attached, I guess because they need to put a number to it, they've attached it to the life cycle of conventional plastic, which is there's a lot of elements at play. Jonas spelled out some. There's humidity, there's temperature, there's bioavailability in the soil if it's disposed of in soil, bioavailability in marine environments. It's a lot of things at play, really. So very difficult to ascribe a number to that.
Thank you, Mario. Okay, so it is 11 o'clock. I really appreciate all the comments. I think people can engage with some of the speakers. You can engage with maybe some of these arguments or differences or things we can take further. I think there's lots of issues to be discussed, and I really appreciate all the comments. Thank you to Mulalu from DFFE that you were willing to be here, and we really appreciate your engagement with us. Thank you for the producers who are engaging. Usually it was very much at a distance, but we are very appreciative of the fact that you are close now. And thank you, Nikki, very much for the presentation, and we really look forward to the results of the research. And thank you very much for everybody who attended this meeting. And with that, I'm concluding the meeting.